The following hour is brought to you by MidasResources.com, your trusted source for precious metals since 1996. Call Midas today at 1-800-686-2237.
Show is here. Welcome back to the NutriMedical Report, and wanted to preface, I really want to thank Ryan, who's done an amazing job collaborating on new nutraceutical development, coming on weekly, doing our shows, explaining the intricacy of our nutraceuticals, which far exceed any other nutraceuticals on this network or any other show, radio or television, including Dr. Oz, by the way. Dr. Oz is kind of playing with the edges of the program. He often will bring on a product here and there. And you only have a few experts that showcase one or another nutrient. But our nutraceuticals, we have a background of literally 500,000 doctors and health professionals worldwide through our Academy of Anti-Aging Medicine, Environmental Medicine, and the American College for Advancement in Medicine, which I belong to, all three. And you got to understand, when you have experts like Ryan, we have always keeping the cutting edge. We're advancing our nutraceuticals, upgrading formulas, bringing on new formulas like our tendon mender, joint performance, and leptin metabolic. There is no comparison to any of our nutraceuticals. Give you an example, CoQ10. Ours is 8 times head-to-head any other CoQ10 in the world in terms of absorption. It's the only one that doesn't crystallize, which makes it biologically inactive. We have the only one. When we look at things like our sulforaphane glycosinolate, this is the only SGS DNA repair nutraceutical in the world. We look at cell detox glutathione, look at Nutritrella. I mean, there's no comparison. All of our vitamins in the final activated state, no other vitamin company in the world, including GNC, Go Online, Life Extension, anybody else has anything even remotely comparable. Then on top of that, I integrate the very best of medicine in terms of investigation and tell you even which drugs are safe to take, which there's a small number that are, and which ones are darn dangerous and you should never take them. So when we integrate those with Ryan's help here, trying to explain these nutraceuticals, you really are getting the premier support on the planet. And, of course, depending on the country, if you've been under the Codex Alimentarius like Europe, Australia, New Zealand, you're getting cut off from even high-dose Power C, the best neutral and the only neutral vitamin C in the world. You're being cut off from nutraceuticals that can change your health and reduce the need for medications dramatically. And, of course, when people have problems like diabetes, heart disease, dementia, multiple sclerosis, we have protocols that can obviate the need for disease-modifying drugs, can regenerate joints. Our Collagen Max makes wrinkles go away. We're not just talking about injecting, injecting Botox or one of these plumping agents, and there's one called, what is it called, Redis, that one of the big drug companies makes. We're talking about actually fixing the inside your body, the metabolism that makes wrinkles not exist. So that's a head-to-head study that was done actually in Europe with our exclusive supplier for it. So Ryan, I want you to pick out your favorites this week. We got a big sale coming on through the 4th of July for, I think, 5 days. And we expect to help a lot of people. We also have a ton of people out there now that have their QRMA machines, and I'm sending back their QRMA analysis report. Usually I will talk to them, take their wellness history, talk about their medical situations. I'll investigate and tell them what test they need to demand from their doctors that are investigational, that'll tell them what problems are going on, and these are both regular and advanced medical. What kinds of functional medicine tests, including blood tests, stool, urine, and other testing, hair analysis can be done through labs like labtestingdirect.com. And that includes your friends at, what was it called, McGuffey Labs? Is that the one that does some of the other?
The Dunwoody Labs.
Dunwoody Labs, and they do the test for the zonulin levels. So if you're having a leaky gut, you want to measure. These tests are certified, federally certified laboratories, but your doctor may be completely in the dark about it because they're not educated. I've been a professor since 1980. That's 34 years. Now I'm retired, and I'm still teaching doctors and patients around the world, more so than ever. In fact, since I retired 10 years ago to do this program, I know far more than when I even retired. And I'm realizing just how ignorant the doctors are. They're in the gerbil cage running to see the next patient. They don't get time to read journal articles. They don't get to go to these functional medicine meetings. They don't learn intermediate metabolism or toxicology. They don't learn about the need for safe use of things like CoQ10 for heart disease and for myopathies. If you've got a myofascial pain syndrome, your body's screaming for CoQ10 Supreme and CoQ10 Supreme Ubiquinol. It's screaming for it. It's saying, please, please, give it to me and I'll get better. But the doctors they scratch their heads and say, you're kidding. You don't need that. But they don't even know how to measure blood levels inside the cells, intracellular levels. Well, we do. So, Ryan, I want you to pick your favorite nutraceuticals, and we'll start there. But I want people to realize they're getting access to information on this program, and especially from you, because you're going to be covering a lot of the details that they won't get anywhere else in the world. And there may be pretenders to the throne that think that, oh, well, I'm doctor this, and I'm doctor that, and I'm chiro this, and I'm MD that. Let me tell you, you people out there are newcomers. I've been doing this for more than a third of a century. I was doing it before environmental medicine, even before Dr. William Ray set up his Dallas clinic in the late 70s. I was an environmental scientist in 1973 before I even went into medicine. So I can tell you, you need to listen. And you're going to find out, at the very least, if you don't believe us, check it out and ask better questions. You're going to find out if you do functional tests, whether it's a QRMA or these blood tests or conventional tests for your doctor, lipid electrophoresis, that we can obviate the need for statin drugs, which are dangerous as hell, and use things like Omega Cod Liver Liquid and Nutrifos and Neurogen and Omega Supreme. You don't need these dangerous drugs, but you need to change your lifestyle, get off the toxic meat, get in omega fatty acids and phospholipids, and when you start doing these things, you're going to get healthy. You're going to get detoxified. So, Ryan, let's start with your favorites.
Well, I like the whole concept on detoxification. People are always wondering what they can do as a way to kind of get their body back in tune for energy, for weight management, and so forth. And I like using the shakes in the NutriMed line are phenomenal. So, Life Support is one of the top formulations for a detoxification shake. So Life Support is built with a really potent amount of vegetarian protein, 26 grams per serving. It's also loaded with lots of anti-inflammatory herbs, balancing nutrients for the liver, both phase 1, phase 2 balancing nutrients. Anti-inflammatory herbs are over 1,100 milligrams per serving. Very unique things in here to help with hormonal balance. Glutamine is over 5 grams per serving. Branched chain amino acids over 3,600. It is really probably one of the most potent and comprehensive shakes to ever be introduced into the market, and it tastes phenomenally good. And so for Life Support, the people that really, they have systemic, kind of problems going on in their bodies, and they want to really press the reset button, I think Life Support's one of the best things they can do. We
mentioned that in hour 3. Hour 1, we mentioned that with Michelle. People want to pick one thing, and they say, I don't like to take pills. So, well, start off with Life Support.
Yeah.
And your body's going to say, that cellular handshake, high fives, thanks. Now I can start my day.
Yes. And, most people, if they do that program, modified elimination diet's a good thing to add to it, where you're starting to avoid things, the dairy and the white flour products, and cut out the alcohol or caffeine that might be in there, and let this go to work for you. And it's just a matter of days. You feel a dramatic difference, and as you continue on using it, I mean, you've spoken about it, Dr. Bill, a bit of this detoxification program where you're giving your body a rest from so many of the challenges that we constantly put in it. And, people experience such dramatic shifts with so many different areas that they struggle with. Particularly weight is one of the big ones that most people have a comment about, but energy coming right behind that, and feeling less, pain and inflammation, just getting rid of those aches and pains that are constantly plaguing so many people. And it shows the power of the food that you put in your body and what it can do.
One of the things that I think people are amazed at is how fast they get a recovery when they take NutriMeds. And the reason is threefold. The first is every one of our vitamins is in the activated state. It's the highest bioavailability compared head-to-head to any other company, any other nutraceutical. It's designed by physicians in practice, or like myself, consulting to help other physicians train to deal with it. It's evidence-based, which means it's based on testing, clinical, genetic, metabolic, organic acids, gene tests, etc. And it has amazing transformative powers that are not compared to anything else, and it's based on science. Science-based. Back in a moment with Ryan.
What if Americans could have A, better health, B, a lower incidence of cancer, and C, a lower occurrence of fibrocystic disease of the breast?
I remember when I lost my mind. There was something so pleasant about that place. Even your emotions have an echo in so much space.
So Ryan, let's pick out maybe 3 or 4 and 5 or 6 of your favorite nutraceuticals, and we'll expand on them. We'll try to plug them into different protocols and kind of explain to people why I beg them, please don't buy nutraceuticals from any other company. Please don't expect advice from even your primary care doctor, internist, family doctor, gynecologist. We'll train them. We'll train you so you can train them. And we'll give, if they call me, I will provide them free training. I'll tell you, I never get resistance. If a doctor's willing to call, and I don't overwhelm them, I will teach them the science behind why the nutraceutical approach will obviate the need for meds, and also what kinds of tests to be done. For example, for prostate, if your PSA is slightly elevated, I tell people to do a free and combined PSA, which will determine if it's cancer or non-cancer. The next step is a transrectal ultrasound needle-directed biopsy. Then this vascular sparing surgery or cryotherapy. Never basically an indiscriminate surgery, which will cause loss of bowel and bladder control. Never gold seed therapy or radiation. So I'll tell them the medicine behind it as well, no matter what condition, because I've been in practice a third of a century. I know all the screw-ups. If I want to go into law, if I get tired of just doing this radio show, I'm already half a lawyer. I took training at the Stony Brook Legal Center in New York City. I've been a medical legal expert under ACOM for 20-some years. I went to court 2 and 3 days a week, and I wreaked havoc in the federal and state courts. And that's part of the reason why the state of Colorado came after me, because I was closing down industry, shutting cases, proving people had traumatic brain injury, and they were major pissed off. And we're talking about right up to the Attorney General's office and the Board of Medical Examiners, because they didn't like DEAGLE. It's like, man, this guy's a problem child. He's got attitude. Yeah, I got attitude. I got attitude because when people tell me, when I was the director of OCMED for Health Source for the entire city of 2.6 million people, Bob Stoner, and I'm going to mention his name because he's the maniac, told me in 1997, you got to close 32 cases. We got to upset employers. And I said, well, 4 of them, if I close those cases, they're going to die. He said, is that a problem? Well, guess what? I have a problem with somebody telling me that he's going to give me $500,000 bonus if I kill 4 people by cutting off their case. So I'm a believer first, Jesus, God first, and I'm sure as hell not going to kill patients as a physician because I want to make a big chunk of money. I didn't go into medicine. I went into medicine to find the cause of diabetes, which I did. The first steps with Dr. Otto Hewen and hyperinsulinemia, and I got persecuted for that too. With Dr. McEwen at the Ron Curry Research Institute at the University of Calgary, who literally was like being on the set of The Exorcist. So people say, DEAGLE's a weird kind of guy. Yeah, I'm weird. I'm weird because I'm in love with God, I'm in love with humanity, and I'm in love with knowledge. And I'm a whirling dervish. I'm completely unsettled until I find the solution to any problem. I don't care what problem you present to me, I will try to find it, and I will do it free. And when people say, what insurance do you take? I said, how about the insurance of, thank you, Jesus. That's the insurance you need to say. And I want people to understand when they get our nutraceuticals, they're supporting not only our ministry, but the ministry to help other people with serious health problems. The ministry to retrain doctors. I'm going to release a series of books. One of the first is going to be on Fukushima and physical solutions to the problem and remediation and protection of people in Japan and elsewhere. Last night on Rents, on the second half of the show, I gave an example of a 12-year-old boy who would come to my office and the horrendous physical changes occurring in his body because of radionuclides, and what I could do to help this little boy, and how tremendously complex it is, and how the doctors in Japan are completely lost, and how I can help them. And people say, well, that's arrogant. No, it's not, because I've been challenging problems that are Gordian knots for decades because that's my nature. People say, well, that makes you real smart. I'm not real smart. I'm real stubborn. I don't just accept that's the way things were. You know, I was a footling breech with a cord and it popped out in my leg, and I was delivered by Dr. Ollie's at the Providence Hospital in Michigan, and he told my father that if he didn't crush my skull and do a craniotomy and deliver me dead, my mother would not survive, so my father threatened him back, and he delivered me DOA. But I came back after 26 minutes. And I was 8.5. I had a French surgeon do an operation on my neck with a guillotine-style little device to pull the tonsil forward, and he lacerated an artery in my neck, and I bled to death. Woke up 18 hours later with blood going in both arms because they went into coma. So I'm becoming a tough nut. And I'm coming back here telling you, humanity better gut up and realize that functional, I call integrated medicine. This is not complementary alternative. It needs to be integrated into medicine. So when people are taking things for diabetes or things for hypertension or things for other health problems like irritable bowel syndrome or colitis, if they don't take functional medicine nutraceuticals, they're going to get into a very deep hole, and the doctors can't rescue them with unnecessary surgery or drugs. They may be able to slow the progress, they may be able to change the cause of death, but they're not going to fix it. We try to fix the problems. So Ryan, pick out a couple that you think are especially important for people to try, and we'll go through them.
Yeah, I think that I think everybody should be paying attention to something like Calm Mind, due to the excessive amounts of stress that most people are dealing with in their daily lives. They end up with a lot of anxiety issues, sometimes turning into raging disorders, but they also manifest into issues where you start getting a lot of craving type problems. So carbohydrate, alcohol, even drugs can be kind of a challenge there. And Calm Mind is just a wonderful product. It's a powder. You can have it in cherry or an unflavored version. You can just add it to juice or just straight to water. Usually 1 to 2 scoops is an adequate dose for most people, and they get a pretty quick response. Somewhere in 15 to 20 minutes is usually pretty significant changes in what's going on and how they're feeling. And it's one of the core ingredients there, myo-inositol, is really fascinating because it serves as a secondary neurotransmitting messenger molecule, meaning when your body is trying to relax and de-stress, if that's not there, if that nutrient is deficient in your body, you will consistently still be plagued by these challenges that your body cannot shut down the anxiety kind of express that it's on. And so this is it's been a remarkable formula. I know in the NutriMed lines, it's one of the most successful of all the formulas out there, and usually starts with one member in a family and kind of moves on from there. So in Calm Mind, keep that one going. Other ones that I think are fascinating, Tendon Mender is just really amazing. Changing a very challenging area for health for a lot of people, and that's repetitive motion injuries, where we're getting into rotator cuff problems, the elbow issues, knees, plantar fasciitis or Achilles tendinopathies, carpal tunnel. These are all areas that become very, very difficult for people to deal with. They usually are on either a brace, some kind of mobility device that stop it from doing something, or they're also at the same time chronically using anti-inflammatory drugs to kind of deal with the constant pain that comes along with that. The Tendon Mender is so fascinating. It's a unique ingredient, comes out of Europe, and it was discovered that it had the ability to basically engage the tendons to thin themselves out, because that's typically what's happening. You're getting a thickening, lack of mobility then it occurs, as well as inflammation and pain. And so this reverses that process from going on, and they've shown in ultrasounds what this material can do, and then in human clinical trials it's very successful. And so I know we've had a lot of success in the NutriMed line with people using it and getting quite rapid response in some very plaguing long-term problems.
Now, one of the other things I found additional, whenever I get nutraceuticals, I always try to expand its use. 42% of the dry weight of all your bones is collagen, and it's type 1. And if you want to rebuild bone, you got to rebuild the rebar in the bone. And guess what? Tendon Mender is the way to go. We combine it with our Collagen Max and Mountain Red Velvet, but Tendon Mender is the key. And then we have our Joint Performance that rebuilds your cartilage, the hydroviscous layer in the joints, and then leptin metabolic that turns off the cytokines in your joints for osteoarthritis and degenerative arthritis.
Global warming purports rising CO2 levels, while evolution describes mutated DNA. The fraudulent sciences describe a...
Welcome back to the NutriMedical Report, and referring back to the second half of the Rents Hour yesterday when I was a guest, I talked about a little 12-year-old boy that had been exposed to radionuclides. His growth hormone was shot, so he was below his normal percentiles. He was getting myopathies, cardiac arrhythmias, muscle wasting. He had already developed some dysmyelination of nerve tracts in his brain. He had a leaky gut syndrome, lack of digestive enzymes. He had crashed his bone marrow, so he was now basically had a low platelet count, was having some problems with with bruising and bleeding. And again, our nutraceuticals will help reverse that. And a lot of people in North America think, well, that won't hurt me. Well, I'll tell you right now, the rate, and this is from the American scientists, the American endocrinologists and oncologists, the rate of thyroid cancer and benign thyroid nodules has increased across the United States, and that's just on the West Coast, 400 to 800%. I was just watching the program the other night called Flip or Flop, which we love watching, which is where the realtors up in Orange County flip houses, and they do a real high-grade, upgrade of homes. They don't do just a cheap one. And one of the young guys, I really like him. His name is Torek, and Christina. They have a cute little girl. And one of the nurses was watching the show, and she had a sharp eye. She noticed in one of the shows he had a huge lump in his neck. And that huge lump in his neck turned out to be thyroid cancer, and thank God it was an aggressive cancer. He ended up having radiotherapy as well. But he's going to need to have support, so he'll need mitothyroid, which is better than just taking, quote, synthetic thyroid, because it's only going to partially correct it. If you leave thyroid only partially corrected, it will turn you diabetic, hypertensive, obese, and you'll be at risk of things like cataracts, free radicals, vascular disease. Dr. Broder Barnes proved very conclusively that all heart disease is basically tied directly to hypothyroidism, both plain hypothyroidism, where you have antithyroid antibodies, including microsomal and antithyroglobulin, or you get TRS, thyroid resistance syndrome, where you're converting to reverse thyroid hormone because you're insulin resistant, which leptin metabolic, dibetaline, and our other nutraceuticals like Lipoflush, etc., will reverse, and glycemics. So he's a good example, but let's talk about detoxification. We have the best detoxification with xenoestrogen detox, NutriDefense, Regenerex, Cell Detox Glutathione, and Nutritrella, and of course Life Support and BioLVR available, and of course for heavy metals, Kilormax, which is the oral chelating agent. I take 4 Kilormax twice a day, and it's not just if you've had previous mercury amalgams in your mouth or gutta percha, which is cadmium from a root canal. All of our food is laced with heavy metals. If you're a regular eater of chicken, all chicken in America, the chicken feed is all laced with arsenic, so you're going to get arsenic. If you're drinking well water, have you had a well test to see if there's heavy metals? Guaranteed, most of the wells in America have free iron, very commonly arsenic, and other heavy metals like lead, mercury, and depending on the area of the country, like the Northeast or Boulder, you're going to have uranium. Don't want to have uranium in your lemonade, do you? So you got to take this stuff out, or it's going to bioaccumulate. Especially now we got Fukushima. We're setting up a radiation site, and it's a gamma site. It'll pick up gamma rays only because it's a closed system, and it won't pick up beta particle emission from strontium or other isotopes or tritium, but it will pick up gamma. So we're specifically seeking out cesium-137. So if there's a cesium surge, we're going to see it on our detector and other detectors tied in with the engineer David Crane. We'll post it up on the Rents Network and on our website. But you got to detoxify. So I'd mentioned this about this little 12-year-old boy, what we could do to help him. But Ryan, let's talk about Kilormax, xenoestrogen detox, BioLVR, life support. People don't realize just the nasties that are in their body, and they may be jogging, they may feel healthy. They're still in their zone of compensation, but they're going to get in trouble if they don't get it out.
That's a good point about, you can compensate for a certain length of time, but after a while, you're going to be overrun and put yourself in a pretty bad situation. So being able to use things like Kilormax to lower the body's burden of the exposure that it constantly has with the heavy metal exposure that's in our environment is really important. So people are understanding of seasonal detoxification and things like that, but they may not be thinking about it in the side when it comes to heavy metals, and they should, because we know that triggers a lot of the inflammatory responses that the body has. And so Kilormax is a really safe capsule version that you can take to help lower the burden of heavy metals in the body. And then using the products like the green tea Supreme.
Green Tea Select, yeah. Green Tea Select.
Green Tea Select is a good thing to back that up with, because not only is it great as an antioxidant to protect you while you're doing the detoxification of heavy metals, it also has such beneficial properties for the way that it protects the body and the tissues. And then it also enhances things like thermogenic activity, which a lot of people enjoy with green tea for weight composition and so forth.
But by the way, one of the things about green tea that people may or may not know, if you have bad breath, it grabs all the thiols in your body. So it'll grab actually the thiol compounds that are being generated by gut bacteria and in the periodontal tissues in your gut, in your gums, and it prevents bad breath. That's interesting, okay? Nice side effect. So that's pretty neat. I tell people, and one capsule, by the way, equivalent to 10 pots of green tea. A lot of people think, well, that's just optional. I can get that stuff. I can go to VitaCost. I can go online. I can go to the local vitamin store. No, you can't. You might as well just cut the label off the product and stick it on the sore body part, because of how useless it is. Are you do you really want to attach and attack the problem and fix the underlying problem with the biological molecule in its highest biological form? Or are you going to just play with it and thinking you're going to second guess and get a nutraceutical that may be equivalent? And paying for something that's useless is a lot more expensive than paying for something that works.
Yep, absolutely.
It's just the same with your vision. I mean, we had this gentleman that ended up with a cataract surgery, and he's now blind at 65, 67. Well, if he had started on Can-C, and we probably could have prevented that. Now, I'm going to recommend that you have at least a few consults with different types of retinology surgeons to see with more advanced procedures to try to see if they can reattach his retina. They can clear the viscus in his eye and put new hyaluronic acid in the eye. They now have replacement fluids for the eyeball. They can we have nutraceuticals that can stop the free radical damage and stimulate neurogenesis of the optic nerve head, because he developed a post-inflammatory optic neuritis. So he's basically got optic neuritis, just similar to multiple sclerosis, or sometimes by itself. Vein away for the eye, for the kidney. If you're spilling microalbumin, and by the way, if you're diabetic and your internist or family doctor is not measuring microalbumin, they're incompetent. And if you go and take vein away, and when you bump the dosage up high enough that the microalbumin disappears, your microalbumin, if you keep spilling it, is going to cause your kidneys to go, see you later, had a nice day. So you didn't just follow BUN and creatinine, you got to follow microalbumin. And as you take vein away, it's going to go back to normal. Same with your eyes. You're going to protect the eye from leakage of fluid in the Bruch's membrane of the capillaries, or rupture of the capillaries below the rods and cones, because what's interesting is the blood vessels are on top and the rods and cones are below it. I mean, if I was designing the eye, I wouldn't have done that, but needless to say, God had a purpose in putting rods and cones below the capillary complex on top of the eye. If you maintain the capillaries and not make them fragile, they're going to be fine, and the vein away will fix that. It also stops spider nevi, deep vein thrombosis, and vascular problems, including vascular plaque. It helps to make the vessels much healthier.
It's a remarkable, the vein away formulation, and all the different applications that supports in the body. Very impressive. Vision
Max, vein away, Nutritrella, those are core for the eye. Cell detox, glutathione, and of course the quercetin is very important. It's present in other nutraceuticals like our amazing formulas to stop free radical generation in the eye.
Independently leading the way for the nation. Compelling talk for every political persuasion. We are GCN.
It's going to be awesome. You just check out the website. It's might be great. Welcome back to the Nutrimedical Report. And Ryan, just want to run through some things that I haven't done for a while. I'm going to pick out some things, some of our nutraceuticals we don't talk about too much. Adrenal support. We always give it along with our Vitathyroid. We have, of course, Biotin Plus we use along with the diabetoline for reversing diabetes, leptin metabolic, and, of course, Lipo Flush, which mobilizes calories out of fat storage. Cell detox glutathione. We haven't talked about this for a little while. It's the most powerful way to get rid of hydroperoxy radical. Cognition Plus and Brain Power. We mentioned about Digestes a few days ago. Mm-hmm. I don't know if we talked about Flash Away with the aprinal neurinogen that stops the production of males turning into female hormone and vice versa, females turning into male hormone, which is the hormone synergy. It's also called Flash Away because it'll stop hot flashes. Vitamin K2, we give that along with our Power C Plus. 3 Power C Plus, 1 Vitamin K2. It's essential if you take that along with our Collagen Max and our MyCell D3 and our Myco D2 for bone healing. Gamma E Plus, this repairs your ion channels. And don't think you're going to get, if you get a D-alpha tocopherol, it's not good. This is the only one to get, the most powerful Gamma E Plus. It's essential if you're trying to protect your heart and your blood vessels. Inflamex, the best anti-inflammatory out there for interfascial tissue, ligaments, and for solid organs. Cell Defense, which is curcumin with the long-acting release technology. We have the Living Probiotic, Roselle 6 strain, and Living Probiotic Ultra, the How Are You strain, most powerful probiotic on the planet. Magnesium potassium citrate, this stops gallstones and kidney stones. It helps you stop the actual formation. Magnesium glycinate malate for chronic fatigue syndrome, mitochondriopathies, etc. Men's Max releases male hormone. And then, of course, we've got the prostate flow to improve and protect your prostate gland from prostate cancer. Hormone synergy to make sure your male hormones not convert to girl hormone, which adipose tissue will tend to do very nicely. Nattokinase to improve vascular health and reduce the plasminogen activator inhibitor 1, or what's called the high sensitivity C reactive protein, very important. Neurogen, this actually stimulates DHA from algae, production of new nerve cells and regeneration of myelin. It's brain protective. Our Cognition Plus has acetylcarnitine, other components to be brain protective. And CoQ10 is very important. CoQ10 Supreme, the only non-crystallizing CoQ10, and CoQ10 ubiquinol. Our omega cod liver liquid head-to-head studies prove it's better than statin drugs. Do not, for God's sake, take statin drugs. Under any circumstance, do not take them. Increase your omega fatty acids with Omega Supreme Krill. I take all of them. I take 2 Omega Supreme twice a day, 2 Omega Krill twice a day. I take omega cod liver liquid, probably 20 mils in the morning. I take the MyCell D3, usually 3 twice a day. You need to maintain your D levels. You can't stay healthy, vascular and otherwise. And, of course, our big 3 power for stopping free radicals, Cell Detox, Glutathione, Regenerex, and Nutritrala. And then, of course, our mainstay, Vitamineral Max and Minerals Plus for your minerals, activated vitamins, and Xenoestrogen Detox. Ryan, pick out of those some of the things that you think are really important. By the way, one of the things we found in people to stop gout is BioLVR. And we use also Sam-methyl, which will be coming back out of back order. And the BioLVR are particularly important for stopping gout. And, of course, we can also increase the prevent gout using the vein away, which helps to get rid of uric acid, and prevent the urate causing kidney stones as well.
Yeah, those are good options right there. And I think that the xenoestrogen detox formulation is such an important one. Our environment is so loaded with these basically xenoestrogens that a lot of people are very unaware of, but you don't want them constantly bombarding your body and then delivering these messages to all our different tissues that deliver these messages. It can be very harmful and set us up for a lot of abnormal cell development. And so neutralizing it and bolstering up your defenses is really important for every man, woman, and child out there. So this is not just when we say about xenoestrogens, this is not a girl problem. This is a human race population problem that we have, because things like plastics, drugs, fuels, pesticides, they all have these xenoestrogens in them that really our bodies are not familiar with. We need extra support to defend against them. So it's a great thing to choose. Also, this product, Xenoestrogen Detox, is very unique. It also has the ingredients that you'll also find and things like Regenerex inside of it as well. And so we've talked many times about the pathway of NRF2 and how important that is for cellular communication to control and balance inflammation, detoxification pathways, as well as enhancing your own antioxidant protection. So xenoestrogen detox really is sort of a staple that I think could be, one of those daily things that many people would use for long-term protection.
Yeah, exactly. Now, if people say, well, I'm really skeptical, I want to find skeptics is good. The first step, which will cut your costs, is to get a QRMA machine and do daily tests, which takes a minute. The second is if you have a bigger bank account and you want to do functional medicine tests, I recommend things like which lab was that again we mentioned earlier? Dunwoody Labs. Dunwoody Labs is really good for measuring, say, gut problems. We use the Great Smokies Laboratory, which is now called Metametrics, Genova Labs in Atlanta, Doctors Data. All these functional medicine labs are accessed through labtestingdirect.com. And I can tell you what tests to do. You can literally order the kits at 70% cost on average savings. Kit will be sent directly to you. You go into a lab, it's signed up by one of their doctors. They'll send the test results to you. They'll send the test results to your doctor. The benefit is we get to train your doctor so they just say, hey, you mean these tests are helpful for cardiac risk, for cancer risk, for detoxification, for all kinds of things that they don't understand. And they will understand because they're trainable. I find I get very little resistance if you don't embarrass doctors and you just train them. They have enough basic science, they'll pick it up. The problem is the drug companies don't want this because if they keep doctors relatively ignorant, they'll accept the drug rep and take a quick and dirty script pad out to write a prescription rather than address the problem. So, any other nutraceuticals do you want to mention?
I think Collagen Max, top seller in the NutriMed, it's one of the top sellers in the NutriMed line, is such a great formulation to constantly remind people about because it makes them feel so good to see the changes on the outside of their body with hair, skin, and nails, the less wrinkling, the
Collagen Max is
harder and stronger and so forth.
It's like a miracle.
Inside changes are so phenomenal.
Yeah, in fact, this is, by the way, studies done by our primary laboratory in Europe, and it comes out of Switzerland, and it shows, I think, 50-some% increase in improvement in wrinkles on photomicrographs done by an independent review within 3 to 6 months. And though it's reducing wrinkles on the outside, it's also reducing wrinkles in your bones, your periodontal tissues, your elastin in your arteries. Your skin, hair, nails are better because the inside of you is better. And all the connective tissues that hold your body together, elastin, collagen, hyaluronic acid in your joints and your eyeballs, hydroviscous layer in your joints, cartilage, the glycosaminoglycans, they're all rebuilt on the collagen backbone. And this rate-limiting step, which is a proline transhydroxylase, that makes the elastin, hyaluronic acid, and collagen and glycosaminoglycans. And so it restores that. 300% increase in the activity of the enzyme just using Collagen Max. It's a choline-stabilized orthosilicic silicon. So people say, well, is this collagen? I said, no. If you eat collagen, you've got the building block, but you can't rebuild it if you don't have the enzyme activity. So you can eat all the collagen you want. If you don't have the enzyme activity to rebuild it and build it into joints and ligaments and hydroviscous layer, it's going to go at the other end of your stool. You're making expensive stool. That's just the way it is, right?
Yep.
But if you have the Collagen Max, you're going to rebuild those tissues in your joints and the connective tissues and your ligaments and your synovial membrane of your around them and the periodontal tissues in your jaw, the sharp A fibers that hold your teeth in place so your teeth don't fall out. The rebar in your bones, again, along with tendon mender and mountain red velvet. These are amazing solutions for your health, and we'll put them together like the colors of a palette, applied for a picture of wellness for you, customized at no cost. We don't have to take your insurance. Your insurance says, thank you, Jesus. The Dr. Bill was sent to try to help me get better with Nutrimedical and NutriMeds. Thank you, Ryan. You've done an amazing job as always. Well, you're going to have, I guess, a week off, and you'll have a great week. We will be seeing Clay on the first hour on Monday, And we'll see you back the week of our big sale coming up, the week just 4 days right before the 4th of July, which is coming up real quick. Thank you, Ryan. Have a great week. And back in hour 3 with Preparedness Civil Defense.
Hi, this is Ted Anderson. If you'd like to listen to GCN programs on the go, I have great news. GCN has created a Droid and iPhone application, and it's free. Just as easy as going to GCNlive.com.